So we need to do a thorough assessment. Includes the history and physical, obviously the history about the bowel movements, how has it been for you? You will be surprised. Some people will say, I go to the bathroom 1 time a week. Wow. But it seems normal to them. Other people say I go twice a day, or maybe once a day, or maybe 5 times a day. That's what you're going to see, but you need to have that thorough history in physical. Defecation daily, I put daily. Medications, what kind of medications they are taking. Some people take suppositories every week, as is a normal thing to do. They take some mac citrate, which tastes terrible. I don't know if you guys had that before, but mac citrate is the awful thing to do. We use it for colonoscopies in the endoscopy departments to check the colon and see if there is any polyps that need to be removed, or for cancer, diagnosis for cancer in the intestines. But then that mac citrate goes in and cleans the whole bowel and leaves the whole bowel totally clear for the doctor to see that with scope. But some people use it because it's over the counter, and they use it because it really cleans the bowel. But the taste is horrible. Horrible. I don't know. I would rather have, I don't know what else, but I did have it one time. I had to drink that thing. Oh. Obviously, diagnostic test is important to know. They have done, when was the last colonoscopy or upper endoscopy done for them, and see if they have any other type of exams. Did they check blood in the stool? All those type of exams needs to be done. You need to ask about any herbs, because the people take some tea to have the gut going, especially minty tea with mint in it. It helps for digestion, especially if they feel like bloated after they eat. Oh, I feel like I feel my food up here. It's just like sitting right here. I need to keep on going down. So hot tea will make it go, especially those with mint, it'll happen. So it's good to know about all those things that people do, and they include all that into the program. So the person who used to take tea every day for 20 years, you're going to give them the tea somehow to make it successful, to get back to where they were. That's the whole point of this. This is very important, guys, very important drone, because I want you to see the type of neurogenic bowel function. Remember, neurogenic bowel is the loss of normal bowel function. So if the person, we're going to see the 3 types of neurogenic bowel. It's going to be uninhibited, which is anything that happens from here up. If the person had a stroke, it's more than likely it's going to have uninhibited. Brain injuries is going to happen. A tumor, brain tumor. Also, MS is part of it. Anything here, then is going to be uninhibited. However, the next one is reflexive, right there in the middle. If it is reflexive neurogenic bowel, then more than likely is the spinal cord injuries that you're going to see the reflexive bowel, neurogenic bowel. People who are quadriplegic, perhaps, they do have reflexive. Alzheimer's disease, for some reason, is considered, uninhibited, I'm sorry. Yeah, because that's part of the brain. But the reflexes is that any trauma to the thoracic area is going to be reflexive. And then we have a reflexive bowel, which is the bottom part. People with the spinal bifida will have that. Diabetes, for some reason, plays a again in a reflexive bowel, neurogenic bowel. Paraplegic, because paraplegic are obviously from the waist down. They have numbness, obviously, and flaccidity. Therefore, it's going to have a reflexive bowel. Any questions? Just remember that one, because on the test, I recommend on that sheet that I pass around, just throw the little man and put it like that. So when you read the question, oh, a nurse entered a patient that had a brain injury 3 years ago, I don't know. And then you already know, oh, okay, I'm talking about uninhibited. That's gonna help you in that sense. More than likely it's gonna be uninhibited. Again, do not compare this bowel with bladder, because do not compare it. Just learn it like it is, okay? And we good. That's slide number 8, okay. Let's start with uninhibited neurogenic bowel. Uninhibited. See, occurs when pathophysiology in the brain, such as stroke, brain injuries, constipation can occur. So we see a lot of constipation when it's uninhibited neurogenic bowel. Any of those, such as Alzheimer's disease or Parkinson's disease, traumatic brain injuries, again, you will see a lot of constipation there. You're going to see a smearing. Why is that? Because when there is constipation, a little bit of fluid escapes, and after you wipe, you're going to see that again. You are wiping those spaces consistently, because you see the smearing in there. When a person has constipation, sometimes just the liquid comes through. And that's what it is. You're going to be cleaning the patient a lot. On those stroke patients as well, especially with the stroke patients, you will see a sudden urge in incontinence. Although they have constipation, you also will see like urge and everything comes out. So you will see the incontinence there. And that sense of urgency on the stroke patients. The sphincters are intact, and the bulbocavernosus reflex is also intact for the uninhibited. How do we treat this type of patient? Oh, one thing that I meant to say about the slide before. For the stroke patients, like I said, uninhibited neurogenic bowel function is often associated with a stroke. However, for those stroke patients, they are able to regain bowel function first, that bladder function. For those stroke patients, the bowel gets fixed first before the bladder gets fixed. And for those patients, we use suppositories at the beginning because of the constipation, but then we move to natural means. And then the natural means should be the long-term goal for them. for all those stroke survivors patients. But the bowel will get definitely fixed first than the bladder. How do we treat him? Toileting. And that toileting should be the same day every day. Maintain adequate fluid intake. This is going to help with constipation. Suppositories may be used at the beginning, but then natural means follow. Other medications, as you know, you don't get tested on medications, but we will talk about it later. And do plan for accidents because of that urgency that I talked to you about. In a stroke patient, they'll be constipated, but then they have the urgency and then they get incontinent. With that urgency, that's when you plan for accidents. So you're gonna have a lot of cold browns with the stroke patients. So if you're a nurse in the unit and you get a patient with stroke, you get a patient with something else, spinal cord, so you make sure that if you have an aid, it's gonna help you out because you're gonna see a lot of bowel movements here if this happens. Let's move into the